everyone. Thanks for joining us today. I'm going to get underway, and can I commence today's session with acknowledgement of the traditional owners. I'm presenting today from the land of the Quandamooka people in the beautiful downtown area of Southern Moreton Bay Island, and I pay my respects on behalf of the council to the traditional owners of all the lands that we're coming from today, and I acknowledge their continuing connection to land, sea and community. I particularly pay the respects of the council and its board members, to elders past, present and emerging. Today we've got a number of things to get through, but before I go there, may I just remind people of some housekeeping issues. Today, all your microphones have been muted for the purposes of the recording. We are recording today's session for those who may not have been able to attend. But if you have any questions during the session, please post them in the Q&A panel. We are taking questions through the session to be answered at the end of the session. So don't leave it until the end, because your question might be missed in being addressed. So please post your questions early. So today's presentation is concentrating directly on the implementation of My Health Record, and particularly its implementation in residential aged care settings. It's my pleasure to have two members of the Australian Digital Health Agency, Julie Curry and Peter Totten, to talk today about how the agency is supporting the implementation, and then I'll lead you through some specific information about the guidelines, how to access it and what's in the guidelines. So without any further ado, I'm going to hand over to Julie and Peter from the Australian Digital Health Agency. Welcome on board, Peter and Julie.
Thank you, Anne. Thanks for having us today. So I will provide a bit of an overview first of the aged care program, and before I do that, I'd like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures, and to elders past, present and emerging. So Peter, I will hand over to Peter in a sec. He'll talk about specifically the My Health Record registration component of the program. But just more broadly, I'll provide you an overview of the program itself. We have been funded by the Department of Health and Aged Care to deliver on or contribute to a number of recommendations of the Royal Commission, and our program runs until June 2024. So we have a number of projects, I guess, that contribute towards those recommendations. Primarily, we have a focus on addressing recommendation 66, which is about transitions of care, and 68, which is the universal adoption of My Health Record. So the first key project is Peter's project, the My Health Record registration one. The aim of that is to connect facilities to My Health Record, and I won't speak any more on that. I'll let Peter speak to that one in more detail. The next one is around working with vendors, software vendors, to enhance their systems to connect to My Health Record and obviously have accompanying functionality around that. We have a current industry offer in progress with 13 vendors. We now have 7 of those conformant to My Health Record, and working very, very closely to progress the final 6 through to completion. It then leads on to the next industry offer that we'll be releasing in July this year. And that will build on what we've done in the first one, but primarily focus on facilitating the implementation of a new aged care transfer summary in residential aged care settings. So that project, the Aged Care Transfer Summary project, really is aimed at introducing a new clinical document to residential aged care settings to be uploaded to support the transition of a resident from their facility to a hospital. So that's a very exciting kind of piece of work to share information digitally. And the final project that we have in our program is around standards, the development of clinical information system standards to support obviously data quality and systemic solutions towards how systems operate. So that project is kind of entering a consultation phase that will commence in July, where I think they'll be seeking feedback on quality statements to inform whatever standards are developed. So I'll now hand over to Peter to talk more specifically about the REG project.
Yeah, thank you, Julie. So my name's Peter. I'm the project manager of the My Health Record Registration Project, or a project that is dedicated to providing hands-on support to residential aged care providers around the country in connecting to My Health Record. A lot of the activities and the initiatives that the agency is delivering upon is very dependent on My Health Record as the solution. So our team is designed to support the sector in connecting to My Health Record. So one of the key activities that we're doing is we are rolling out a registration campaign nationally in a state-by-state approach. So the campaign is a series of messaging and promotional messaging. So we lean heavily on the primary health networks, the PHNs, to distribute promotional messaging about us, about My Health Record, some of the benefits in residential aged care, things like that, to encourage adoption and use of My Health Record essentially. The second activity as part of that registration campaign is some targeted messaging where we proactively reach out to providers and facilities around the country and talk a little bit about what we offer. So on the right-hand side of the slide, you can see a little bit about what sort of registration support that we do offer. We have dedicated registration support officers that are allocated to providers to see them through the registration process from the very beginning through to the end. And once you are registered, we do have the agency's education team that does post-registration education. And in that, we handle many of the conversations and the topics like consent, all the different rules and responsibilities around using My Health Record. So the support material that we offer and share include things like the My Health Record guidelines, AHPA's My Health Record readiness toolkit, key resources like that for the sector that we find very useful in helping communicate My Health Record and the benefits. We do offer registration support regardless of your organisation type or structure. We do tailor our support material direct to you and look to register you for My Health Record regardless of the software you use. Different things like that. We do tailor our material to speak to you. And at the bottom of our slide there is a contact email address for our team. We do welcome inquiries. If you're interested in connecting to My Health Record, please do reach out to that email address. We're here to help, and we're looking forward to hearing from you.
Thanks, Peter and Julie, and I know that you're going to stay on board to take some questions at the end of today's session. So it's a really important piece of work that is being forged here. And the Aged Care Industry Technology Council is very supportive of the uptake of My Health Record. But before I continue to talk about how we see that can be done practically and take you through the guidelines, for those on board, I just introduce you to the work of the Aged Care Industry Technology Council. It was established in early 2000s and formalised in 2007. The council itself brought together the then two peaks to look at harnessing innovation and technology with a clear and direct focus of providing really robust evidence to improve outcomes for older people, but significantly to improve the quality of aged and community care throughout Australia. So the challenge about My Health Record, I think, is in front of us. The Royal Commission did make some clear recommendations about the universal adoption of My Health Record. And clearly we've had improvements in the uptake of utilising or registering for My Health Record recently, with 23% of residential aged care facilities now are registered to the use of My Health Record. But you can see we've got a long way to go beyond that, and it's our challenge to work with the Australian Digital Health Agency to improve the uptake. So why and did we get involved? We see, as I mentioned earlier, critical importance of having a consistent record throughout the work that we do as aged care providers. From the outset, I'd like to thank the work of other organisations that assisted at the time of writing the guidelines, and particularly note the partnership we had with the Allied Health Professionals of Australia, Leading Age Services Australia, Asian Community Services Australia, now of course AHPA, and the Australian Nursing Midwifery Foundation. All of them worked really diligently to provide the most user-friendly and useful guidelines. We believe it is a very useful guideline. It's a really valuable tool, we believe, to promote continuity of resident care and improve health outcomes. It's also a really key issue in providing guidance and resources to residential aged care facilities. But it also allows aged care providers to view and upload residents' health information that's relevant to their care. And it's got a really significant potential to improve the care coordination for older Australians. I'm going to actually lead you through specific parts of the guidelines shortly, but just to reinforce that in putting together the guidelines for residential care, we worked really strong to cover a range of roles and acknowledge those roles are explicitly discussed in the guidelines, and how each of the individual roles within your organisation might be uptaking those guidelines. The next slide shows a table of the contents available for the uptake of My Health Record and what the guidelines specifically cover. I'm going to go through each of those areas directly as part of this presentation. So the first part of the guidelines really provides a succinct coverage of what My Health Record is about, an outline of the summary of the key health information that is held for individuals. It outlines its fit within a national system and its accessibility. It emphasises that it is personally controlled and details the protections in place. We also detail why we need to use My Health Record, and particularly I call out those recommendations that are on your screen now, 56, 63, 66, 68 and 109 that were directly Royal Commission into aged care quality and safety recommendations. We do, those specific recommendations talk to residential care providers being encouraged to adopt My Health Record by June 2024. So there are some timeframes in which providers are encouraged to meet, and indeed that the My Health Record uptake will support the aged care quality standard and accreditation processes, namely standard 1, 2 and 3. And generally just that these guidelines provide you with timely access and current health information about your residents. The residents' information is extensive, and a range of health information is available within the My Health Record framework. Of particular relevance to residential care settings would be medication management, hospital discharge statements, advanced care planning documentation, and much more. Policy and compliance requirements are covered within the guideline. In particular, this is really targeted at your teams within your residential aged care facility an organisation that are responsible for policy compliance, risk, governance and quality assurance. Before My Health Record can be used, all residential care facilities must have in place a developed security and access policy, and the guideline details the requirements for that. The use of My Health Record in residential aged care is, of course, governed by a suite of legislation, including an Act, rules and regulations, and the guideline does cover each of those specifically. And the guideline calls for all staff to be appropriately trained before accessing and using My Health Record system, and this training must be outlined in the security and access policy. Privacy and security is a main feature of the My Health guidelines, and it is a really major part of presenting this nationally. This section of the guideline might be seen to address anyone who uses My Health Record in your organisation. All My Health Record material is managed and protected in accordance with My Health Records Act of 2012 and the Privacy Act of Australia of 1988. These are key guiding legislation, and the guide covers this. The guideline also includes access and organisational structure requirements, management of clinical incidents, management of data breaches, and penalties that are involved in all of those. The next section covers concisely connecting to My Health Record. It's really targeted at your more technical users who are responsible for the connection of My Health Record in your organisation. And I know from the names participating in today's session, there are many of those folk on today's registration. It is also about how you register for My Health Record as an organisation, and where you need to identify key roles, including responsible officer and organisation maintenance officer. The guideline provides you with succinct and detailed steps in which to connect to My Health Record. Those steps are well outlined in the guidelines and appear concisely and are detailed in this map on your screen now. You can do that either through the provider portal or your own software if it is conformant. The next section gives you a guideline at using at users approved to view or upload My Health Records. It will help you understand how authorised users can view, edit or delete documents through the available channel. The next section of the guideline really talks to supporting residents, and it is targeted at staff responsible for instructing and supporting residents in the use of My Health Record. Residential care facilities can choose to either assist their residents to register and access My Health Record, and the section will cover the circumstances where under emergencies access can be provided and the differences between residents nominated and authorised representatives. The next section of the guidelines speaks to external healthcare professionals and how these external healthcare professionals interface with My Health Record in your residential care. These external healthcare professionals can access client records, provided that they have a healthcare provider identifier, and details how to register for this identifier are included in the guidelines. The guidelines are now available from our website, and you can scan this QR code on the screen to download the My Health Record guidelines directly. If this QR code challenges you at all, just go to our website at www.aciitc.com.au and you'll see the guidelines. You will be asked to complete a short survey, and I guarantee to you it is very short, as the council tracks all downloads to provide feedback both to our internal team on how to improve the accessibility and use of those guidelines, but where relevant, we do pass that information on to the Australian Digital Health Agency. We've had hundreds of downloads of the guidelines, and we believe that this is a great initiative since the guidelines have been released. And there is support available, as Julie and Peter outlined earlier, directly from the Digital Health Agency. And you'll see the direct link there on your screen now. There is support in accessing the document from the Aged Care Industry Technology Council. And there's a range of other information contained on the My Health Records section of the Australian Digital Health website. And the key direct link to that is on the screen now. We're going to go shortly, and I'll ask Julie and Peter to rejoin me on the screen to question and answers. So now is your opportunity to raise any questions that you have about implementing My Health Record in your residential care facility. Thanks, Julie, and thanks, Peter, for joining us again. It is a great opportunity to showcase what we have done in the guidelines, but really this is a great opportunity for you to take the questions from providers who are online today and to go through hopefully providing some solutions or some assistance and advice. I've got a question that's a recurrent one in our in all our projects. I think about its application to community care. I've got 7 or 8 providers that are on today who are wondering who are just community care providers, not both. And I know that we've got several providers online that are both residential care and community care. I guess the question is, Julie and Peter, when can we look forward to a similar guideline in community care? Thank you.
Thank you, Anne, and thanks for that question. And yes, we're very much aware that obviously our program's focus of work is on residential aged care. Therefore, it does leave a gap and a bit of a hole around the community care sector. Unfortunately, I can't answer the specific question around when it will be available in community care, because the program is only funded at the moment to deliver on residential aged care. I know that it is being considered by the agency, but there's nothing defined in our work plans as yet.
Thanks, Julie. I've also got another question around conformance software. How many are there? Where do we access them? And how do other vendors get opportunities to become conformant?
So a couple of things there. So any vendor can choose to become conformant to My Health Record. You don't have to participate in an industry offer. So the agency still does have a process where we support any vendor who wants to be conformant to My Health Record. And we're able to share the email address that you can contact to do that. The vendors who are currently participating in the aged care industry offer, there are 13 of those, and they are a combination of clinical information system software vendors as well as electronic medication management system vendors. 7 of those are conformant now, so we're working to get the final 6 kind of over the line, and they are Best Practice, Accredia, who was formerly known as Open Informatics, MPS Connect, Manad Trust, Compact, Unleashed Technology, Modius. They are the current vendors who have just achieved conformance to My Health Record. The agency also does have a conformance register. So it does actually also list any other vendor who's, may or may not have participated in an aged care industry offer who's gone through the conformance process. We've got a register that specifies who those vendors are.
We, as a registration support team, are working quite closely with these software vendors to offer these vendors the support for their customers. So we recognise that the residential aged care providers will need to have registered for My Health Record to utilise the new functionality in these software products. So we're working quite closely to make sure that the providers who can use conformant My Health Record products do know about our offer of registration support and can reach out to us for help.
Thanks, Peter. That's great information. I'm going to go to Barry's question. Thanks, Barry. Barry's a IT guru and is part of our national roundtables and works on a lot of co-design groups. So I have a shout out to thank you, Barry, for all your involvement. His question is there a co-funding, available through the agency or any other agencies to undertake this work?
Unfortunately, not through the agency. No, there isn't any funding specifically to facilities. And I'm aware of, I guess, business improvement initiatives that you may be able to access funding for, but there's nothing specific through the agency.
We do, however, offer a registration support officer. So it is a resource that we do dedicate to you as a provider to guide you through the registration process and really help break through some of the barriers and the challenges there are for that registration process. So, yeah, there is a resource available, certainly.
Thank you. Another question from a great contributor also to our roundtables and our co-design group. Thank you, Craig, for also being online. Craig's question is there a deadline to complete registration for residential aged care facilities? And I guess we saw on the screen encouragement by June 2024, but I'll ask you to answer that question specifically. And if not, are there any plans to mandate this rather than encourage?
I won't talk to the registration timeline. I'll leave Peter to comment on that one. But in terms of mandating, what we're doing at the moment is a nice to have. It's not mandated. It's not, and so it's all voluntary. The government hasn't made a position yet. It may come, not sure, to mandate the use of My Health Record in residential aged care. As you are probably aware, they have moved to mandate pathology and diagnostic imaging results, but there's nothing indicated yet around mandating the use in resi care.
In terms of timeframes for our registration support team, so we are a project that has been set up till 30th of June 2024. We are developing a lot of support material resources that we will share with the agency's broader teams. There are a number of teams that do look at registration and connection to My Health Record. So a lot of the tools and materials that we're developing will be shared with the agency, but the registration support team right now is set up through to 30th of June 2024. But I might put a caveat on that and say that the agency is always offering support in registrations, regardless of whether you're an aged care provider or any type of healthcare provider. So right now it's just a team dedicated to residential aged care specifically. But we always want people and providers connected to My Health Record. So we're always here to help, regardless of timeframes.
Thanks, Peter. I've got a question here from a provider I know that's a small standalone rural provider. We're considering purchasing new technology. Should we only be looking at conformance software?
I would suggest yes, because it does allow you, I guess, the ability to view and eventually upload information to My Health Record, which maximises the benefit of the use of My Health Record. But again, that's a business decision for you to make, and I'm sure there's many other criteria that you probably need to consider and look at in your decision making.
Thanks, Julie. It's certainly from the point of view of the council, where telling providers, if you're looking at new procurement, you should direct yourself to look at those who are conformant or taking the steps to become conformant. So thank you for that. We've got another from an attendee about how do you foresee the information being used practically in residential aged care. To access My Health Record, the staff member must have a PROTA login. In most facilities, the number of staff with this access is very limited, both in management and senior clinician. After hours, the greater majority of RNs do not have PROTA log on. Thanks for that question. I think you are raising some systemic issues.
This all ties in with the conversation about conformance software. So through the registration support process, we do teach providers how to set up their HPIIs, their healthcare provider identifiers for individuals. And this has a close relationship with conformance software or non-conformance software. So we assist registrations for the National Provider Portal, which is a view-only way to access My Health Record. So that's one thing to cover, and that's certainly covered in the guidelines. With conformance software, there are logins to use these products in reality within the facilities. So this is all handled internally, of course, but in there is certainly login considerations to note with the HPIIs linking the software and the identifiers and things like that. But it's certainly something we do cover in our registration support, and certainly as well in our post-registration education. We do really teach you how to use My Health Record and extract the benefits as best as we can.
If I can just extend that as well. So at the moment, I guess, because the aged care transfer summary is not available yet, that will be the primary document that can be uploaded to My Health Record by residential aged care facilities. So we foresee that usage should increase once the ACTS is available to be uploaded. That's why I guess a lot of the projects at the moment, so Peter's project around registration and the industry enablement piece, are foundational pieces of work, preparing for usage uptake, hopefully, once the ACTS is on board.
Thanks, Julie and Peter. Another question I've got is, are you aware of if there are any help from any state or territory governments to help us implement My Health Record, given that this is an important way of improving the transfer of care from acute care to residential aged care?
Yes, so we are working, I guess, with Vic Health and a number of other jurisdictions. They have projects underway to support their public facilities to register to My Health Record. So each jurisdiction is doing something slightly different, but the answer is yes to that as well.
Thank you, Julie. Where can you find the information on conformance systems, and where do vendors find the information about what you've got on offer?
Perhaps, and we'll share those links and direct you to the right places on the agency website, and to share out to your members after the webinar.
Great, thank you. I think people are really after those direct links and to save time as well. Another question I've got here is, what's next for the implementation of My Health Record? One of our colleagues is asking, there were some very good examples when the personally electronically controlled health record first was released, of residential aged care facilities being able to use and had great plans for using that. Do you have any interest or vision in your future work to showcase those examples to perhaps help other providers think through the application and benefits for their organisation?
Yes, so I can share with your with everyone today that the budget announcement around the support at home piece of work. So the agency will actually be undertaking a piece of work next financial year to look at how we can potentially transition aged care assessments from the My Aged Care portal into My Health Record. So that will be a piece of work being undertaken from July this year to look at that. I guess it does kind of highlight that there are conversations happening around how we can broaden what we do in the agency to support aged care and community care more broadly. But all I can really talk to at the moment is the one that's confirmed around looking at transitioning aged care assessments into My Health Record.
I think that's been long called for. I think if you read our roadmap in 2017, we called that one out. So it's great we've finally got action towards that. The next question I think really does speak to that synchronisation of the different records that are around. And again, the questioner is asking, will My Health Record be synced with the hospital EMR records, or is this sometime down the track?
There is, with the government's announcement of continued funding for the agency, a key kind of piece of work that the agency will look at is around the modernisation of My Health Record and what that actually means. So I know there's a lot of planning currently kind of in process to determine what that looks like. Specifically in response to is the hospital EMR syncing to My Health Record being looked at? I am sure, I cannot say definitively yes, but I'm sure a number of scenarios will be looked at as part of the planning process.
Thanks, Julie. There are really important steps to synchronise the records. All of us want one record used many times, not many records not used many times. So thank you for that. Look, that's all the questions I've got on my screen or in my emails here. I'd just like to take the opportunity to thank Julie and Peter for their presentations today and encourage everyone to download the guidelines. We hope that they're very practical and user-friendly. They have been co-designed intentionally to make them that way. The Council is very keen to see a greater uptake. We need to move that dial from 23% of residential care facilities using it, and certainly we're encouraging that work around synchronisation of other records. Thank you again for joining our session today. If you've got any further queries, please address them to the email for the Secretariat on board now. And we thank you for your attendance today in what is, we know, a very busy time of the year. Thanks again for your interest in today's session.